everybody, my name is Shilpa. Welcome to this video. I will be talking today about some high-yield psychiatry facts. And again, this is one of those videos where it's not organized, so I'll just be going through bullet point by bullet point. And hopefully this will be a good summary for you when you're starting to study or at the end of your studies to make sure that's a checklist to make sure you know all the high-yield concepts. So I have another video on psychiatry. I'll have a couple more coming out as well. So this is just one in a series. So I do recommend watching all of them to get the most out of it. Okay, so let's get into it then. So first point is MAO inhibitors, and they are an effective treatment for depression, for atypical depression, that is. So they're effective treatment for atypical depression, but they're not first line because of their side effect profile. And remember that atypical depression is associated with hyperphagia, and that's an important distinguishing factor from melancholic depression. And then in atypical depression, patients will be seen with increased appetite, weight gain, and sleep versus MDD, which is the opposite. Next point, risk factors for postpartum psychosis include first pregnancy, history of bipolar or psychotic disorder, and then family history and recent discontinuation of psychotropic medication. Okay, next point, what is methadone? What is methadone? So methadone is a long-acting mu receptor agonist used to treat opioid withdrawal symptoms. So when you think about methadone, think about opioid withdrawal symptoms. And then what is naltrexone? Naltrexone is used to prevent relapse in opioid use disorder, but it's only in the absence of acute withdrawal symptoms. So if you have withdrawal symptoms, then you want to use methadone. If you don't have withdrawal symptoms, you can use naltrexone. What is methadone again? So methadone, remember, is for opioid withdrawal. And then what is naloxone? Remember that naloxone is used for opioid overdose. In addition to typical opioid adverse effects, tramadol may also be a cause of decreased seizure threshold and serotonin syndrome. So remember, tramadol is going to be associated with seizure threshold, decreasing the seizure threshold, that is, and serotonin syndrome. When do you use benzodiazepines and beta blockers? In what specific disorder? They can be given in the performance-only subtype of social anxiety disorder. What are second-line treatment options for generalized anxiety disorder? So second-line treatment options for generalized anxiety disorder. These ones are going to be buspirone, TCAs, and benzodiazepines. Buspirone, TCAs, and benzodiazepines. What kind of problem do patients with OCD have? Are they ego-syntonic or ego-dystonic? They are ego-dystonic, which means that their behavior is inconsistent with their own beliefs or attitudes. Agoraphobia is a phobia characterized by what? By irrational fear and anxiety in uncontrollable environments. So that's such an example is going to be wide open spaces or crowded spaces or public transportation. And then treatment is going to be SSRI plus CBT. And then second line treatment is going to be MAO inhibitors. How do you remember the symptoms for post-traumatic stress disorder? It can be remembered with the mnemonic HARD. So I'm going to write this out here, high yield fact. So remember hyperarousal, H for hyperarousal, H for hyperarousal. Okay. And the next one is A. A for avoidance of associated stimuli. So avoidance of associated stimuli. So remember avoidance. And then re-experiencing the nightmare. So R is for re-experiencing. So they'll have nightmares and flashbacks. Re-experiencing the event, so they'll have nightmares and flashbacks. And the last one is D for distress. So changes in cognition and mood. So remember this, we'll go through this one more time now. H, check it off in your head. What does it stand for? It stands for hyperarousal. A, what does it stand for? Avoidance of associated stimuli. And what does R stand for? Re-experiencing the event. And what does D stand for? Distress. And this is for post-traumatic stress disorder. Okay. How do you treat social anxiety disorder? Social anxiety disorder can be treated with SSRIs or venlafaxine, and then benzos may be used acutely. What is Munchausen syndrome? It's a factitious disorder characterized by a history of multiple hospital admissions and willingness to undergo invasive procedures. So remember, factitious disorder, the people are trying to obtain the sick role. And going back to atypical depression, what symptom is it associated with? It's associated with lead-in paralysis, such as a feeling of heaviness in the limbs, as well as a sensitivity to rejection. What medication can be used to treat premature ejaculation? That would be SSRIs. And then diabetic neuropathy, what are the treatment options? First line is going to be pregabalin. And then second line options are going to be amitriptyline, which is a TCA, as well as duloxetine, which is an SNRI. So we'll continue on here. And I know it's a bit dry, so just keep going with me, and then we'll be done in about like 10 more minutes. And if you're two-timing this, we'll be done in 5 more minutes. Okay. So what are the symptoms associated with serotonin syndrome? That is, what is the symptoms associated with serotonin syndrome? This can be remembered with the 3 A's. So it's going to be neuromuscular activity, hyperactivity, so clonus, hyperreflexia, hypertonia, tremor, and seizure. And then next point is going to be autonomic stimulation. So hyperthermia, diaphoresis, diarrhea. Last point is going to be agitation. So remember, neuromuscular hyperactivity, so clonus, hyperreflexia, hypertonia, tremor, and seizures. Autonomic stimulation, hyperthermia, diaphoresis, and diarrhea. And then agitation. Name 2 TCAs. That would be doxepin and amoxicillin. These aren't the only ones, but these are tricyclic antidepressants, doxepin and amoxicillin. What side effect do you have with TCAs? It's associated with QT prolongation, which then, as you already know, can lead to torsade de pointes. What is phentolamine? So phentolamine, I know it's associated with pheochromocytomas as well, but remember it for this too. So it's an alpha-1 and alpha-2 antagonist that can be used to manage the hypertensive symptoms of tyramine toxicity. And then what medication can be used for smoking cessation? That would be bupropion. Remember, you can't use this medication with people who have had a history of seizure disorder, and you can't use it in anorexic or bulimic patients because it lowers their seizure threshold. What can lithium be used for? Lithium can be used to prevent relapse, as well as treat acute mania and bipolar disorder. What can chronic lithium toxicity cause? It can cause neurologic symptoms such as tremor and ataxia. What happens in patients who are taking lithium who are also on thiazide diuretics? Renal clearance is going to decrease in these patients. Same thing with other nephrotoxic agents such as NSAIDs and ACE inhibitors. What is topiramate? It's an antiepileptic, and remember that it may cause myopia and acute angle closure glaucoma. What does lamotrigine cause? Lamotrigine causes SJS. It's the most severe side effect, so discontinue it at the first sign of a rash. What is carbamazepine? It's an anti-epileptic agent, and it's associated with blood dyscrasias, such as aplastic anemia, as well as agranulocytosis. What are people with cluster A personality disorder associated with? They are described as odd or eccentric, and they're unable to make relationships. And there's a genetic association with schizophrenia. Paranoid people, or with people with paranoid personality disorder, are characterized by a pervasive distrust and suspiciousness of others, with a profoundly cynical view of the world. What is schizoid personality type? These people are characterized by voluntary social withdrawal and with limited emotional expression. What about cluster B? What is cluster B associated with? These are associated with dramatic, emotional, and erratic subtypes. Cluster B also has a genetic association with mood and substance abuse, so mood disorders and substance abuse. Antisocial personality disorder can only be diagnosed if the patient is greater than 15 and has had a history of conduct disorder before age 15. Sorry, did I say 18? Patient greater than 18, conduct disorder less than 15. And then patients with cluster C personality disorder are described as anxious or fearful. And then cluster C personality disorders have a genetic association with anxiety disorders. So let's go up top here and then see what specifically these ones are associated with. So paranoid we talked about, associated with suspicious, distrustful, and hypervigilant behavior. Schizoid prefers to be loner, detached, unemotional. Schizotypal is going to be eccentric, odd thoughts, perceptions of behavior like magical thinking. So I always think about Harry Potter when I think about schizotypal. Antisocial is going to be disregard and violation of the rights of others. Borderline is going to be chaotic relationships, sensitivity to abandonment, labile mood, impulsivity, inner emptiness, and self-harm. Histrionic is going to be associated with dramatic and superficial and attention-seeking. Narcissistic is associated with grandiosity and lack of empathy. Avoidant is avoidance due to fear of criticisms or rejection. Dependent is submissive, clingy, needs to be taken care of. Obsessive-compulsive is rigid, controlling, perfectionist. Remember that anorexia nervosa is defined as excessive dieting, exercise, or binge eating, and the person has to have a BMI of less than 18.5. What is it associated with? It's associated with amenorrhea due to loss of pulsatile GnRH secretion. And then anorexia may also present with what other symptoms? Anemia and electrolyte disturbances. What is refeeding syndrome, and what is it characterized by? Refeeding syndrome is important for a patient with anorexia nervosa because it's when you feed a patient after they haven't been eating for a while. It's characterized by hypophosphatemia, which is very dangerous, and this is secondary to increased insulin. and this may cause cardiac complications. Bulimia nervosa is defined as binge eating with recurrent inappropriate compensatory behavior. That's important, and that distinguishes it from like binge eating disorder. So, and this occurs weekly for at least 3 months. At least 3 months. And then they also may present with Russell sign, which is going to be dorsal hand calluses from induced vomiting. Also high yield to note. Okay, and then just a couple points on erectile dysfunction. So patients with erectile dysfunction due to psychological etiologies have nocturnal penile tumescence. So we'll go into more detail of that here. There's a chart. So there's different causes for erectile dysfunction. There's vascular, neurologic, psychogenic, endocrine, medications, and hypogonadism. So I won't go into all of them in detail, but I do want you to know that for psychogenic, they have normal non-sexual nocturnal erections. Vascular is associated with smoking. And then neurologic is associated with diabetic neuropathy. And then it can also be associated with SSRIs, high yield, antihypertensives, and anti-androgenic medications. Sleep terrors occur during non-REM sleep. So stage N3. And when does nightmare disorder occur? That occurs during REM sleep. What is narcolepsy? Narcolepsy is a sleep disorder that results in recurrent lapses into sleep or naps at least 3 times per week for 3 months. It also has one of the following: cataplexy, which is brief loss of muscle tone followed by or precipitated by a strong emotion like laughter or excitement. They also have low CSF levels of hypocretin 1, and then shortened REM sleep latency. Associated features are hypnagogic or hypnopompic hallucinations. So while going to sleep or while waking up, they have hallucinations, and as well as sleep paralysis. And it's caused by a decreased hypocretin or orexin production in the lateral hypothalamus. And remember, it's characterized by nocturnal and narcoleptic sleep episodes that start with REM sleep, so sleep paralysis. It's associated with cataplexy, which we just talked about, which is the loss of all muscle tone followed by a strong emotional stimulus, such as laughter. Medical therapy for this is going to be modafinil for the diurnal sleepiness. This is a CNS stimulant. Alternate ones include nighttime sodium oxybate, and which should never be taken with alcohol or other CNS depressants because it may cause life-threatening respiratory depression. For cataplexy, sleep paralysis, and sleep hallucinations, you can give either SSRIs or SNRIs. Okay, next topic. What are the typical antipsychotics? So the first generation antipsychotics. These include trifluoperazine, fluphenazine, thioridazine, and chlorpromazine. And then the low potency typical antipsychotics are what? That would be chlorpromazine and thoridazine. Next topic. Neuroleptic malignant syndrome is often characterized by what? Lead pipe rigidity. Generalized lead pipe rigidity. And then we have this chart here, so I'll go through this quickly. Remember that pre-contemplation is where the starting point is when people are making a change. And then they go to contemplation. Then they go to preparation/determination. Then they go to action/willpower. Then they go to the maintenance, and then optionally they'll go back to relapse before going back to pre-contemplation. So that's the cycle of making difficult decisions. QT prolongation is associated with typical and atypical antipsychotics. The typical antipsychotic is associated with retinal deposits is what? That would be thioridazine. Name two atypical antipsychotics, second generation. That would be loperazidone and ziprasidone. And then most atypical antipsychotics exert their effect by how? By blocking D2 dopamine receptors and serotonin 2A receptors. Clozapine is generally useful for what type of schizophrenia? That would be treatment resistant, as well as schizoaffective disorder. Atypical antipsychotics can cause metabolic syndrome, which is what? That would be characterized by weight gain, dyslipidemia, and hyperglycemia. Risperidone is a blank antipsychotic that causes blank. So it's remember, atypical antipsychotic, it has an idone at the end. So remember that the ones with the dones usually are atypicals. And it's going to cause hyperprolactinemia. And then carbidopa exacerbates the neuropsychiatric side effects of levodopa. And then lastly here, what is the first line treatment for restless leg syndrome? That would be dopamine receptor agonists, such as ropinirole or pramipexole. And then finally, for neuroleptic malignant syndrome, the symptoms are going to be altered mental status, fever, muscle rigidity, leading to resistance, dysarrhythmia, tachycardia, hypertension, tachypnea, diaphoresis, and so those are all symptoms of autonomic instability. And that's all for this video. I hope it helps. Thank you so much for watching. Take care.